So we have Tom Slaymaker and Rick Johnston, who are both working with for the JMP, and they're going to tell us about the latest update and how they've monitored the sanitation and hygiene statistics. So over to you guys.
Good morning, everyone. It's a pleasure to join you this morning for us, this afternoon for some of you. So I'm Rick Johnston at WHO, and this is Tom Slaymaker at UNICEF. And together we coordinate the Joint Monitoring Programme. So we're also going to make a joint presentation. So I'll kick things off and then hand over to Tom about halfway through. So with that, the topic of this is going to be around Target 6.2 on sanitation and hygiene. Let's see, let me figure out how to advance. Yes. But it's worth recognizing that this target is one of several targets within the dedicated goal on water and sanitation, SDG6. So target 6.2 on sanitation and hygiene, and the WHO and UNICEF Joint Monitoring Programme are they're called custodian agencies that are mandated to do the global monitoring of these two indicators. But there are these two targets. But there are these other targets with other monitoring institutions associated with them. So we have target 6.3 on wastewater with the indicator of wastewater safely treated. The WHO is also involved in monitoring along with UN Habitat. And then we have 6.4 on water use and scarcity, 6.5 on water management, and 6.6 on ecosystems. Now, sanitation, of course, has a very close link with target 6.1 about drinking water safety, drinking water quality. And it also has a very close link with target 6.3 on wastewater treatment. But sanitation is also important for water use and scarcity. If you think about water scarce regions and reuse of wastewater, certainly with IWRM and ecosystem health. So really sanitation permeates the whole SDG6 target. Sometimes people call it the water target, but it is the water and sanitation target. And then you have these two means of implementation indicators, 6A and 6B, which are about partnership and cooperation and participation of local communities in water and sanitation management. Again, both of those very much related to sanitation as well as to water. So within that framework then, let's zoom in and look a little bit at target 6.2 on sanitation and hygiene. So you see the target text. And it has a lot of important, meaningful words in it, that there should be access to adequate, but also equitable sanitation. Hygiene for all. Hygiene's new to the global monitoring framework. Ending open defecation, while also paying special attention to the needs of women and girls and those in vulnerable situations. Now, those are a lot of different concepts, and in order to adequately monitor different aspects of them, we're actually going to be treating the sanitation bit and the hygiene bit as independent sub-indicators. So you can see that there's going to be one indicator about the population using safely managed sanitation services, and the second one about the population with a basic hand washing facility at home. And let me just take you through the hand washing one. First of all, we're all very happy that hygiene and hand washing have made it into the 2030 agenda. It was a big gap in the MDGs, and there was certainly a lot of advocacy and pushing, probably by many of today's participants, to ensure that hygiene and hand washing would be reflected. And so we're pleased about that. We've actually also, a little aside, we've renamed the Joint Monitoring Programme. So we're now the Joint Monitoring Programme for Water Supply, Sanitation, and Hygiene. And we've even put hand washing on the cover of our first SDG baseline report that you see up in the corner there. So the indicator that we have for hygiene then is the availability of hand washing, a hand washing facility on premises with soap and water. And that counts both for the hygiene component of 6.2.1, but also there's target 1.4 under the poverty goal. Under goal 1, target 1.4 speaks of universal access to basic services, and water, sanitation, and hygiene also count as basic services. So this is actually counting towards two different SDG goals. So you can see below there's a definition of what hand washing facilities are. They can be fixed, like a sink, or they can be mobile, like a bucket that's carried around, a jug or basin. And also for soap. It can be bar soap, liquid soap, powdered soap. Traditional or local materials like ash or soil wouldn't count towards the basic level of service, but we have this limited level of service, which is some of the components of basic, but not all of them. So if a household had a hand washing facility, but was lacking soap or was lacking water, it would count as a limited hand washing facility. And then, of course, at the bottom of the ladder, we have no facility, no hand washing facility at all on premises. So then in the 2017 report, we published data for 70 countries about hand washing. There are now standard questions on hand washing in many of the household surveys, especially the demographic and health surveys and the multiple indicator cluster surveys. And these don't just ask people if they wash their hands or if they have hand washing facilities, but say, can I see the place where you wash your hands? And then the enumerator checks to make sure that there is soap, that there is water available at that place. Now that means we have good data coverage for countries that have a lot of household surveys, like in sub-Saharan Africa, but much lower data coverage for the middle income and high income countries. So if you note on the plot here, for Northern America and Europe, a small number of data points that we have, whereas for some of the other ones, for especially sub-Saharan Africa, we have, I think it's 34 out of the continent, 34 countries with estimates. So taking those together, we were able to make estimates for only 2 of the 8 SDG regions, and we saw big differences there, with sub-Saharan Africa having on average only 15% of households having basic hand washing facilities. And the other region is called Western Asia and Northern Africa. And in that region, there were 76% of households who had basic hand washing facilities. So there's definitely a very widespread, but in the least developed countries, also relatively low prevalence of hand washing facilities. Let me click on then and just show these are the 70 countries, and using those colors for the ladder, you can see again that especially in sub-Saharan Africa, there's quite a lot who not only lack basic facilities but have no facility at all. But even in the other regions, in Latin America and Caribbean and Central Asia, there are in Western Asia and Northern Africa, there are a few countries certainly that still have quite low coverage of hand washing facilities in the home. So one of the things that we're going to be working on in the next 2 years before the publication of our 2019 report is how to extend this data coverage, especially to countries that are middle or high income countries where we don't have the same coverage with household surveys. Okay, so that's hand washing. Let's move on now to sanitation. In sanitation, like in the MDGs, we have a ladder, and that ladder starts at the bottom with open defecation, people who use no facilities at all, moving up into people who use unimproved facilities. But the top rungs now, limited, basic, and safely managed services, those are all people who use improved sanitation facilities, but then we layer on additional levels, additional factors to reflect the level of service. So a limited sanitation facility is defined as use of an improved sanitation facility, but one that's shared with 2 or more households. Whereas if it's not shared, then that would count as at least a basic level of service. And again, that links back to that SDG target 1.4 on basic services. But in order to count for target 6.2 and the safely managed sanitation indicator, there are these new elements. It should be an improved facility that's not shared with other households, like the MDGs, but also where excreta are safely disposed of in situ or transported and treated off-site. And we'll go through all of these rungs in a bit more detail and the different ways that wastes can be counted as safely managed, but this diagram kind of summarizes that safely managed services, really there are 3 pathways into that. There's having wastewater that's treated off-site through sewers and delivery to a treatment plant, or there's on-site sanitation systems where the excreta are either emptied and treated off-site also, or never emptied, and that counts as treated and disposed of in situ. So we'll come back to those, but let's first start with some of the highlight numbers from the 2017 report. Well, first of all, we were able to make estimates for 84 countries throughout the world, and 5 out of the 8 SDG regions, and a global estimate. And the global estimate was that 39% of the population, or 2.9 billion people, used a safely managed sanitation service in 2015. And an additional 29% of the population, or that makes 5 billion people in all, used at least a basic sanitation service. Now, with 7.3 billion people in the world, that does mean there's still 2.3 billion people lacking basic services. And those are these 3 rungs, the limited, the unimproved, and the open defecation, where we still see 600 million people using limited sanitation services, shared facilities that are otherwise improved, and 892 million people still practicing open defecation. And in the graph on the right, you can see quite a range among the different regions, with fairly low coverage of safely managed sanitation in Latin America and Caribbean, and relatively high in Australia, New Zealand, North America, and Europe. But insufficient data to make estimates in Sub-Saharan Africa, Oceania, and Central Asia and Southern Asia. So let's unpack that a little bit in the next picture. This is kind of walking through the ladder a little bit sideways, if you will. So at the global level, we could calculate that 76% of the population used improved facilities. And then there was this 8% of the population that was using improved facilities, but which were shared. So discounting by 8%, you get to 68% having at least basic sanitation. And now, for the first time in this report, we've disaggregated those people with at least basic services into the type of sanitation facility they use, whether it's a sewer connection or another improved on-site system, like a septic tank or an improved latrine. So that 68% then you can divide into 36% with sewer connections that aren't shared, and 32% with improved on-site facilities that aren't shared. And then we look to see, well, what happens in terms of wastewater treatment, safe disposal in situ, and emptying and treatment. And we collected data on those things and found that 27% of the population globally uses sewer connections that aren't shared and where wastewater is treated, at least to the secondary level. And we'll come to the details of treatment in a few slides. But then for the improved on-site facilities, the 32% of the population, 13% of those we could say were disposed of in situ. They never left the premises. But as for emptied and treated, we were able to collect information on emptying of on-site sanitation facilities in some countries, but weren't able to collect enough information on the fate of the wastes that were treated, how many of them made it to treatment and received adequate treatment. So at the global level, we don't actually have a zero. We have insufficient data on emptied and treated. Then if you combine the wastewater treated and disposed of in situ, that's how you get the 39% of the global population, or 2 out of 5 people, using safely managed sanitation services in 2015. Okay, now let's unpack that a little bit and see where those numbers came from. So the starting point for this whole analysis is to classify households into using improved facilities or unimproved facilities, or in fact no facilities at all, and open defecation. So this is something that the JMP has been working on since about 2000, I think. And in 2008, we worked very hard to harmonize and standardize the questions on drinking water and sanitation that are used in household surveys, so that the response categories could be consistent and clear and mapped clearly into either improved facilities or unimproved facilities. And we're in the process of updating that and refreshing it for the SDGs, but this same concept of classifying facilities into improved or unimproved will definitely carry over. And you can see on the slide that improved facilities could be flush and pour flush toilets, could be pit latrines, could be composting toilets. But these unimproved facilities You could have a flush toilet, but one that flushes into an open drain. That would not count as an improved facility. Or a pit latrine that doesn't have a slab or an open pit. Or, of course, hanging latrines, bucket latrines. So, since the publication of that core questions document in 2008, there's been a lot of harmonization and standardization. So the household surveys and censuses that we draw on really have gotten a lot more consistent about that. And we have, what is it, over 2,000 household surveys in our database now that we drew on for the 2017 report. Well, just from that technology classification, then we can get the numbers around open defecation, where you saw still 892 million people practicing open defecation, and because the data sets that we draw on go back till 2000, we can look at trends and see what the rates of progress are as well. And here you can see by different regions, different rates of progress, and also different numbers of people still practicing open defecation, where there's still 2/3 of the people who continue to practice open defecation live in Central and Southern Asia. Most of these people, the great majority, 9 out of 10, are living in rural areas. The good news is that we do see that the rates of open defecation have been decreasing in all regions since 2000, but that in some of the regions, Sub-Saharan Africa and Oceania, because of large population growth and in some cases urbanization, the number of people, the population practicing open defecation has actually increased. So the shaded part of this graph shows the acceleration in progress that would be needed to eliminate open defecation by 2030. So I mentioned now we're, for the first time, disaggregating on-site sanitation facilities and sewer connections consistently. And I think one of the things that was a bit of a surprise in doing this is that at the global level, it's actually quite evenly split. So you see about 38% of the population using sewer connections and 38% of the population using improved on-site sanitation systems. And these numbers include sharing. But if you look then at different regions or different types of countries, you see some very interesting and different trends, where the lower income, the least developed countries, the small islands, the great majority of people are using on-site systems, whereas if you look at the Latin America and Caribbean, Western Asia, North America, Australia, and New Zealand, the great majority of people using sewer connections. But still, even in the highest income countries, there remains 10, 12, 15% of the population using on-site systems. And it's probably the most appropriate technology for small communities and hard-to-reach areas. So this implies different approaches to achieving safely managed sanitation, and certainly in the short term, there might be a long-term vision of extending sewer coverage to greater and greater numbers of people, but certainly in the short term, there's quite a lot of people using on-site systems that can be safely managed and need to be considered in the short term. Okay, so that's just the technologies, the improved and the types of technologies. Then those same household surveys, a subset of those surveys, ask questions about sharing and the number of people who share sanitation facilities. And as in the MDGs, the shared facilities won't count towards the basic or the safely managed sanitation services levels. And that's for several reasons. First, there are health concerns, and there have been and continue to be epidemiologic studies linking shared sanitation with adverse health outcomes, and even small numbers of sharing of household sharing facilities tend to have worse health outcomes than those not sharing at all. But aside from that, there are also some of these human rights related concepts of privacy and dignity and being able to access facilities safely at all times when needed, in the night, alone for women, that also raise concerns about if shared facilities should really be counted at those higher levels of service. So as in the MDGs, we'll continue to report on shared facilities, but we'll be calling them then these limited sanitation services. And again, that's about 8% of the global population, but in certain countries, sharing is much more prevalent. So you see on the graph there some countries where shared facilities are used by more than 20% of the population. Okay, and of course the people who aren't sharing but are using improved facilities, those are having at least a basic level of service. And one thing that we did was looked at the rates of progress on basic sanitation and saw how that was, and compared that to the current levels of coverage for basic sanitation. So in this graph you can see in that upper right-hand green triangle, those are countries that aren't yet at universal basic sanitation, or well, they're below 95% in 2015. But where their annual rate of progress over the past 15 years is high enough that they would be on track to reach universal basic sanitation by 2030. So for instance, in Laos, People's Democratic Republic, they've been averaging over 2 percentage points per year over the last 15 years, and it looks like they're at 70–75% now, so that's well, that's fast enough rates to easily reach 100% by 2030. Whereas in Cambodia, they're also achieving over 2 percentage points per year, very high progress rate, but because their baseline is lower, at that rate of progress, they wouldn't reach 100% by 2030. So you can see that there are quite a number of countries, 89 countries, that are making progress, but that progress isn't fast enough to reach universal by 2030. And then there is a smaller set of countries where basic sanitation has actually been decreasing over the 15-year period. So obviously in those countries, there need to be efforts to turn around that trend. Okay, I'm going to pass the microphone over now to Tom Slaymaker, who will walk through the safely managed sanitation services and elements. Tom.
Swap places?
Yeah, that's probably easier.
Okay, thanks Rick, and hello everybody. So as Rick has highlighted, still quite a long way to go to get everybody access to a basic sanitation service, and that will be the indicator that is used for tracking progress towards SDG 1.4, which is universal access to basic services. But this top rung of the ladder that we're calling safely managed sanitation services is much more ambitious and has been a real challenge, both in terms of monitoring, but also in terms of achievement. So there is a big discussion going on at the moment about where countries are in terms of safe management of sanitation services, and what is a realistic target for them to be aiming for by 2030. But let's have a look at those 3 different routes that Rick mentioned. So once we have identified the proportion using improved sanitation facilities, and we've split them out into on-site facilities and those with a sewer connection, we can then go into more detail looking at these 3 possible routes to safely managed. And the first route here highlighted is safely disposed in situ. So this means that the excreta which is being produced is being safely disposed of on the household's premises or in the local area. It's not being removed and taken away and treated elsewhere. So this is something that we can collect through household surveys. We've been piloting some new questions, looking at household behaviours and trying to understand, firstly, has it ever been emptied? And secondly, if it has been emptied, well, when was it emptied? Was that recently or was that several years ago? And do households actually know? And we find that, generally speaking, we can find this information when we ask it of households. There are a small number of households who struggle to answer this question, especially if they are tenants and it's the landlord that is responsible for the emptying, or maybe the emptying was done before they moved in, it was a long time ago. But what we can do is to collect information on the frequency with which pit latrines and septic tanks are being emptied. But then the next question that we want to answer is, well, where was it emptied to? Where did the contents end up? And when you're talking to a household, they may tell you that it's removed by a service provider, and they may tell you that it was emptied by the household itself. So these are the two main types of answer that you might expect. And they may have some information about what the service provider does with it. They may not know. But if they emptied it themselves, then they're much more likely to know what happened to the excreta. So it's possible that they emptied the pit latrine and then they dug another hole and buried it and covered it over. They may have just covered over the pit latrine and then dug another one. Or possibly they emptied it, or they paid somebody else, perhaps a neighbour or another member of the family, to empty it and then to take it away. And if it was simply discharged into open ground or a water body or somewhere else, then we would not consider that to be safely managed. So amongst these different possible answers that we're getting from the household surveys, if it's never been removed, then we would consider that to be safely managed. It's never been emptied. But if it has been removed and buried on site, then we would consider that to be safely managed as well. If it has been removed and it's been unsafely discharged into a local environment, then that would not be considered safely managed. So this is just to give you an example of the type of data that we were able to collect for the 2017 update. And it's showing you the proportion of on-site facilities which have been emptied. And so in some countries, such as Japan and Pakistan, you're seeing very high rates of emptying. There is a regular emptying of pit latrines and septic tanks. And in those countries, you would expect there to be some kind of services available to treat that waste and to dispose of it safely. But in other countries, you see very, very low rates, and down in Mozambique and in Ethiopia, very low rates or no emptying at all. And so we have a full spectrum here, and what we need to be able to do is to understand what the practices are, what proportion of the population is regularly emptying on-site sanitation facilities, and where those wastes are going to. So when it is emptied, then ideally it is then being transported somewhere and it is being treated so that it is then safely disposed of. And this is an example, if you are familiar with the country files that we produce for all of the countries for which we produce estimates. This is how we try to classify the information that we get. So down the left-hand side, this is an example of a survey from Senegal from 2014. And for every single national survey that we have, we go through and we extract the information which is relevant to our classification. So you can see here that we have some data in Senegal on the proportion of the population using on-site sanitation facilities which have never been emptied. 46% there at the national level, and quite a big difference between rural and urban. We're also able to extract information on the proportion which are then emptied and discharged locally. So that 19.1% would be unsafe. Okay? But then there are those that are emptied and removed off-site, usually by a service provider, and that's 34%. And we want to know where that is going to. We want to know whether or not that is reaching a treatment plant. And it's only when we have information from the treatment plants that we would be able to consider that to be safely managed. The same goes for latrines, and because you'll notice that the numbers are the same for the septic tanks and the latrines. This is because the survey is not distinguishing the emptying practices for these two types. But we do have this basic information. But in order to be able to understand what is happening to the waste that has been removed from the household and taken away, we're not going to get that information from households themselves. We have to get that information from the sector. And so the sector may maintain information on desludging services. so the households which are covered by some kind of emptying service. We can also collect information on the number of fecal sludge treatment plants, the type of plants that are available, and the type of treatment that is being applied. And in order to be able to class it as safely managed, we're looking for treatment of both solid and liquid wastes. So we put these two pieces of information together, the information from the households about whether or not the pit latrines and septic tanks have been emptied, and the information from the sector on what is happening to that excreta. So this is just to show you the treatment ladder, if you like, that we have. On the left-hand side, you see the ladder for the treatment of wastewater. That's excreta which is transported through sewers. And on the right-hand side, you have a ladder for the treatment of excreta from on-site sanitation. I'm sure many of you will be familiar with these. But the classification of treatment for wastewater is fairly well established. Many countries are able to tell us whether it is primary, secondary, or a tertiary form of treatment, and we're able to classify accordingly. So for the purposes of global monitoring, we have said that in order to count as safely managed, there needs to be at least a secondary level of treatment for wastewater. Now, of course, it may be more advanced than that in many countries. And when we work with colleagues who are looking at target 6.3, which is about safely treated wastewater, then they will be interested to go into much more detail on those more advanced levels of treatment and to put that information together with the exposure risks for the population. So that is a more sophisticated type of analysis that will be done for 6.3. But for our purposes, we're looking for at least a secondary level of treatment. For the fecal sludge, we are looking for treatment of both the solid and the liquid fraction, and there are a range of different ways in which that can be done. But this has been a really big challenge for us, is to be able to find information on treatment of fecal sludge, and also to be able to determine exactly what type of treatment is happening. So this is a really big data gap, and is something that we will be looking to work with you on to fill in order to be able to make better estimates in future. So this is the data for the third route to safely managed, which is transported through a sewer to treatment and treated off-site. This is average figures for the different SDG regions, and you can see quite a big variation. So where we have data, we can see very high levels of treatment, as you might expect in North America and Europe, but also in Eastern Asia and Southeastern Asia. But then coming down and in Oceania and Latin America and the Caribbean, but particularly in South Asia and Sub-Saharan Africa, we have much lower levels of treatment. We're not actually able to make a regional estimate for Sub-Saharan Africa because we don't have sufficient data, but we do have data for a number of countries in that region. So we can look at least developed countries, and we can look at the world as a whole. If you see there the landlocked developing countries, 59% of wastewater receiving at least secondary treatment, and globally we estimate around 73%, so 3/4, you might say, of wastewater receiving at least secondary treatment. But a very big variation amongst the SDG regions, and of course an even bigger variation amongst the countries within those regions. And it's really important to emphasize that while, as Rick said, the foundation of our estimates remains household surveys and censuses, we have more data than ever on what households are doing, and the data that we have means that our estimates for the type of facilities that they are using and whether they should count as unimproved, limited or basic are probably better than ever before. But in order to be able to make estimates for safely managed, we need to be drawing data from the sector, and in particular from regulators. So we will be doing more and more work with regulators in the future to understand the data that they have on both on-site systems and sewage systems. We have some interesting information coming through now on design and installation, and in some countries, a small number of countries, there are inspections of on-site systems. So the example on the left, I think, comes from Ireland, where there are inspections of septic tanks, and they report on the proportion which are functioning. So that's something which we can look at in more detail in future, and we'll be able to make adjustments if we know that a significant proportion of the population has on-site facilities which are not functioning effectively and not safely containing the excreta. But we're particularly interested to understand what's going on with the excreta which is emptied. And very often there will be trucking services, and in some countries those are regulated and in some countries they are not. But that information will be really key for us to understand the proportion which is actually reaching treatment, and then of course we want to understand the type and level of treatment of fecal sludge. For the sewage systems, as I said before, we have much better data. The data that we have assumes that the majority of the excreta going through the sewers is actually reaching treatment. A small number of countries have data on leakage en route, but not very many. So that's something that we would look into in more detail in future. Of course, there may be data on overflows and unsafe discharges, which there are usually standards for and regulations for, but that data is also not widely reported at the moment. But what we can do is get some basic information on the type and level of treatment which is being applied to the wastewater which is transported through the sewers. So, in terms of where we are at the beginning of the SDG period with our first ever global baseline estimates, almost all countries have data on open defecation, and this is something we've been working on for some time. So we're able to produce estimates for almost all countries in the world. But there are multiple different definitions, as you know, of open defecation free. So the indicator that we're using is simply the population practicing open defecation, and this is based on the main practice within the household. Of course, if individual members of the household are asked about their sanitation practices, you might find a bigger difference. And also, if you look at whether or not every single household in a community is no longer practicing open defecation, then you might get a different number. But these are different definitions and different numbers which are produced where those data are available. But the basic estimates for open defecation are available for almost all countries. Similarly, for basic water and basic sanitation, we have these data. They're coming from household surveys and censuses. But relatively few have data on hand washing with soap and water. We have about 70 in the global database at the moment. And we expect that to increase over time. It has been increasing over the past 5 years. I think we had 54 in our 2015 report, and we have 70 in our 2017 report. But the big challenge there will be collecting this information for high-income countries, where this data is not routinely collected. But there's a really big difference, and it's important to highlight this, between the data that we are collecting on the population using services and the data that is sometimes produced by sectoral ministries on the infrastructure that's been built. So very often we will find that the ministry has recorded that a very large number of water points and sanitation facilities have been constructed, but when we ask the households whether or not they're actually using them, we get a different figure. And so the JMP will always use that second figure. We will always ask the households because that is a more reliable estimate of whether or not households are using them and whether they're getting a benefit from the services which have been built. So in terms of safely managed, over a third have estimates for safely managed services, which I think we were very pleased with. We were surprised. We were worried that we would not be able to get this data, and we were pleased that so many countries were able to produce estimates, even if it's just for the rural population or for the urban population. They may not have estimates for the entire population, but we have something. And so countries will be working to fill those gaps. Many have data on wastewater treatment, as I was saying, but relatively few have data on on-site sanitation facilities, in particular fecal sludge management. So data is generally less widely available for rural areas and less widely available for on-site facilities. So we've had really unprecedented level of feedback on these SDG indicators. We had consultations throughout the beginning of 2017, and we had detailed feedback from over 100 countries. And this is not just low-income countries. This is middle-income countries and high-income countries. These targets and these indicators are relevant for all countries. It's a universal agenda. And so for the first time in a long time, countries in Europe and North America are interested to work with us to understand the progress that they're making. And it makes for a very interesting conversation because we now have low-income countries and high-income countries trying to learn lessons from each other. And of course, there are some really big questions about the routes that high-income countries have followed in order to achieve safely managed sanitation, and the routes that low-income countries might follow. And it's not necessarily the case that low-income countries should all be aspiring to have pipe sewer connections. So individual countries are expected to define national targets and plans for achieving the SDGs. They're not expected to simply copy and paste the global targets. The global targets are aspirational, and individual countries should use those as a reference when setting their own targets which are going to be relevant to local context. And then there's a lot of work to do in order to be able to set a target and also to cost it and to figure out what is realistically achievable between now and 2030 and what needs to change in order to be able to achieve those targets. It's partly to do with money, of course, but it's also to do with capacity and to do with partnerships amongst governments and non-government agencies and international agencies like ourselves at UNICEF and WHO. There are some really interesting questions as we engage in country missions. A lot of the discussion is about the appropriate sequencing of efforts to end open-effication first, and then get everybody access to a basic level of service, versus trying to improve existing levels of service and trying to achieve safely managed sanitation services. There are interesting questions about the allocation of resources for water and versus sanitation and hygiene. I think countries in the past may have thought that they were doing very well on drinking water, and now are re-evaluating that based on the estimates that we have that take into account quality and availability of drinking water, which has not previously been used for global monitoring. And then, of course, there's always this tension between trying to reduce inequalities and trying to do that on a sustainable basis. And so these are the common themes that are part of these national dialogues on setting SDG targets and monitoring them. But in all cases, we will need to see an increased effort into strengthening national platforms for monitoring. That's partly about updating the questions that are used in household surveys, but it's also about strengthening the data that is collected by regulators and gradually harmonizing those indicators over time. We've done a lot of work to harmonize the MDG indicators, and that has enabled us to be able to make comparisons across countries during the MDG period. And now we need to embark on a similar process for the SDG indicators, so that we'll be able to progressively produce more robust estimates, which will enable us to assess progress, but also to track rates of progress over time. If you're not familiar with our website, you should take a look. We have a new website which has a number of additional functions for every single country for which we have data. You can go in and you can analyze the data that we have. You can create your own graphs. You can create tables. You can display this information on a map. You can even create a graph and then save it and send it to somebody else, or download it and insert it into a PowerPoint or a Word document. So there's a lot there. You can download individual country files. So if you're interested in a particular country, you can click country file and you will download an Excel spreadsheet which includes all of the information that we currently have for that country, which includes all of the surveys that we have on file, and it shows you how we have classified the data that we've received. So that's a good way of understanding the data that has gone in and how it has been used to make the estimates. And we're always interested to hear feedback on that, and if we can improve the interpretation of the data, or if there is additional data which is available that we're not aware of, then we would love to hear from you. And I think we will leave it there and then open it up for further discussion and questions. So thanks very much for your time. I hope it's useful.
Thank you so much. If anyone's like me, I love data, get quite excited by looking at statistics. But there's a lot in that presentation, so just so everyone knows, I will upload the presentation in the forum thread so people can have a read and take it all in at their own speed, because there was quite a lot in that. And the whole way through I was going, I wish this information had been available when I was doing my dissertation. It would have made my life so much easier. But there have been a lot of questions, and I have to say, between the two of you, you've done a great job of answering them as we go, and I'm trying to keep track of them as they come up. A lot of discussion around classification. I think that's probably been one of the biggest challenges for this this massive project, is how do you classify certain things, and one person's definition is completely different to another's, and when you're talking internationally across governments, it's quite the challenge. So what we will do is, while there are some answers to these written down, I'm going to start from the top. So we've had some questions about Latin America, and in particular the fact that there's less data from that region, whereas in the African, European, Asian continents there's a lot more. So to summarize on that, what do you think you guys are going to be able to do to try and get more data from that area and engage better? If you can answer that. Sorry, Tom, we've lost your sound. Oh, there you go.
No, sorry, I was muted. No, this is a very good question. So I think the conversations we've been having with countries since we've been consulting on the data that I have is partly to understand the status and to understand the baseline. And that's been a very big conversation. It's involved a lot of government stakeholders and non-government stakeholders, and there is a process of coming to a common understanding of the terminology and trying to agree on a terminology which is understood and used consistently across countries. And that is a process which will continue. And that's part of the reason that we run these webinars as well, is to gradually get all of the wash sector stakeholders speaking the same language. But it will take time. But then, having established a baseline, or not being able to establish a baseline, then the conversation usually moves on to, okay, what are we going to do to fill these data gaps? And there we tend to work with a number of different stakeholders. So in all cases, we would want to work with the National Statistical Office. And the reason for that is because we are only allowed to use data which has been approved as official statistics. And so the National Statistical Offices run household surveys and censuses, but they also work with ministries to guide them on the collection of data through the Drinking Water Ministry or the Environmental Ministry, or even the regulator. And it's very important that whatever is collected by those sectoral ministries is approved by the National Statistical Office for use as official estimates. So if those surveys are not done well and they're not approved for official reporting, it's a huge missed opportunity. And we have lots of examples of where individual ministries are collecting data, but they're not collecting data which is representative of the entire population. They may be just collecting data which is for the population using the pipe sewer network, or they might be just collecting information on the population in urban areas and not rural areas. So what we have to do is to piece this information together, and in some cases we're able to make an estimate just for rural or just for urban, but in many cases there is data which is neither sufficient for rural or for urban, and therefore can't really go into our national estimates. So there's a lot of work to do with the different people who are collecting data, and the first thing is to make sure that everybody is measuring the same thing and using the same definitions. And the second thing is to try and agree a division of labour. So not all of this information can come from household surveys, and nor should it. But we do need to have a plan in each individual country based on what is the most appropriate source of data for the different elements that we need in order to be able to make an estimate of these different service levels. And that is really a dialogue that is going on right now and will continue. We can provide some guidance. So for example, we met earlier this week with International Household Survey Programme experts to talk about updating the recommended set of core questions for use in household surveys and censuses, and we will do that and we will publish that. And that is also something that many large NGOs and international agencies can use in their baseline and endline surveys. They can use the same questions, and where the same questions are used and the same indicators are produced, that enables us then to have a conversation with the national authorities about whether those data can be used. So if we have big NGOs collecting data, then potentially that could be used in future as official statistics, but it's very important to involve the National Statistical Office at the early stages of data collection. On the specific regional gaps, so Latin America and the Caribbean, we've been talking there with the Inter-American Development Bank and the World Bank, which are doing a lot of work in the region about the data collection activities that are going on and trying to align those with the SDG indicators. And there, one of the challenges is getting data on the population which is not served by public systems. So we have reasonably good data on the public systems, but much less good data on community-run systems, particularly in rural areas. So there's a big gap there that we need to start to fill.
Okay, thank you. And talking about more on the kind of data collection, Rob raised about getting data from informal settlements, and I think this kind of goes back to how we engage, and you've touched on it a little bit possibly from a government level, but at a lower level. So how do we get better data from informal settlements? And you did mention about defining informal settlements, but how do we do this without making surveys more complicated? And this actually links into what Jesus is saying now about using civil society organisations for data collection, and whether that's something that you guys can explore at all.
No, it's a good question, and it's something that we've been working on for some time. So we try and report on inequalities, and of course rural and urban has been there as a standard type of disaggregation that we've been doing during the MDG period. We've also started to look at wealth quintiles, and so that is something which we can get from some household surveys, and that gives us an understanding of the differences between the rich and the poor, but it doesn't tell us where they live. The other thing that's new for the 2017 update is that we now have been trying to systematically extract data for subnational regions. Now, subnational regions are essentially the next level down from national. So they could be states in India, or they could be districts or provinces. It depends on the country. They're called different things in different countries, but it's the admin level one. And so that is another way in which we can analyze the data where those subnational regions are recorded in the surveys. But it's not all surveys, and also the names of these subnational regions change over time, which is very frustrating. It makes it difficult to be able to determine the trends. But you will find those data in our database for about 80 countries. And the question of informal urban, so within urban inequalities, is something that we've also been discussing for some time. But the real challenge here is the definition. And because there is not an agreed definition, it makes it very difficult to sample these populations. So in a small number of surveys, we have seen attempts to sample the population living in slums, and these are defined in a particular way in a particular country, and then you can compare the population living in slums versus the rest of the urban population to try and understand the differences. But in many cases, this isn't data that will be useful to compare across countries. It's useful for a discussion within a country. But if you're really interested to collect data on informal settlements, then there's no reason why you couldn't have a dedicated survey looking at informal settlements. Adding additional stratifiers to a national survey is not necessarily going to give you that much more information on these populations. So if there are particular issues and challenges and problems faced in any given population group or geographic region, then they can be the subject of a dedicated survey, and those need to be carefully designed in order to define the population that you're trying to target and to get a representative sample. But we do have examples of those. The only other way in which we can get data on informal settlements, which is also being explored, is the georeferencing. So if we have a clearly defined geographic location in which the informal settlement or slum is, which is not always the case, of course. Sometimes they are geographically discrete, but in many cases slum dwellers are scattered. If it is geographically defined, and if the data that we have is georeferenced, then potentially we can put those data together. There are some studies going on at the moment to try and do that, and we'll see what is possible. But this is really at the moment on a case-by-case basis. We don't have sufficient data for a large number of countries to report this routinely in our global estimates, but it is something we're interested in. We sit within a much bigger group, which is called the Interagency and Expert Group on SDG indicators. And they are a group of member states which are talking about how on earth we're going to monitor all of these SDGs and some of the common challenges. And of course, inequalities and disaggregation is a common challenge. The use of geospatial data is a common challenge across many of the indicators. And also the use of unofficial data. So this question about can we make use of data which is produced by citizens through mobile phones or some other mechanism, big data, if you like. Can we make use of that? And there is a live conversation going on amongst representatives from statistical offices about how to use unofficial data or big data to complement the official statistics, to be able to triangulate, to be able to collect information which is not available through official statistics, and to include that as part of the bigger conversation on reporting progress towards the SDGs. So I expect you will see some movement on that over the next few years and some guidance, and we will be working with others as well to see what we can do in the WASH space.
Thank you. And I think that's the key thing to remember with this. It's a huge project, like in some ways incomprehensibly big, with the amount of data and the different directions it's coming from. And there are quite a few questions around specific definitions for WASH, around unimproved sanitation, including flush, poor flush, where you draw the line between sewers and drains and how that gets classified. And I think rather than go into those kind of specific questions, what I'll do is I'll email those to you and you can give some quick answers to those, because I think it's hard. It's a massive discussion to decide what to define something as. I remember once trying to define sustainability, and it means so many different things to so many different people. It's a vast discussion on its own. So I'm going to gloss over some of those, but what I would, there's a question here that actually has come up with something similar with Oxfam recently, about a hygienic shared latrine cannot be accepted as a safely managed solution because it's shared, but in many situations communal sanitation is often the best option due to just space and resources. And I would be, kind of interested to know a bit about why you can't have hygienic shared latrines.
Well, I think you can have hygienic shared latrines, but the question is whether those could count towards safely managed services or not. And I think if you're only focusing on the pathogen transmissions, certainly well-managed shared facilities can adequately exclude feces from future contact and can be collected and managed technically correctly. And in fact, they could well count towards safely treated wastewater under Target 6.3. But we're bringing in these other aspects of service levels, drawing on the human rights framework. So it's really thinking about the privacy, the dignity, the accessibility at all times. You know, can women go in the middle of the night safely and conveniently to a facility that's either outside the home or in a public facility? You know, there are limitations there, and I think it's fair to recognize those and to call those limited services, but still also recognize that that may be the most appropriate solution, at least in the short term, especially in high density settings. So, I mean, it should be recognized that there's value in investing in high quality shared sanitation facilities, at least in the short term, where that is the best technical option. In fact, we just published an editorial on this, and I'll try and put the hyperlink into the chat box. Yeah.
Please do. I'd be very interested in that, because we've just had some research about the safety of communal latrines and how it doesn't matter how nice it is if it's not safe. So it'd be interesting to look at that, but that's a separate discussion. So there's also a discussion going on between the value of the wealth of data from urban situations and less good quality data from rural, and whether this has an impact in the long term for funding. You did respond a little bit, well, Rick did, about the value that rural is often more on-site sanitation. So the safely managed is a slightly different question because the service is slightly different. But I think it's understanding this difference, whether urbanization is going to lead to prioritization of urban sanitation over rural sanitation, and whether this will have an impact on work and how you focus data recording in the future. Yes, was that question clear?
Yeah, I think what we've always tried to do is to ensure that whatever framework we put in place for monitoring in rural and urban is the same, and not to treat rural and urban fundamentally differently, because based on the sort of human rights principle, that what is most important is that people are achieving the same level of service. But when you look at the data that we have on safe management of sanitation, the important thing to remember is that there are different possible routes. And so it may be the case that it is relatively easy to achieve safe management of sanitation in rural areas through low-cost technologies. In fact, it is in many cases. But achieving safely managed sanitation in an urban setting would require a different set of technologies and approaches, and is likely to be much more expensive. So I think there's a difference between looking at the allocation of resources to those areas and assessing the levels of service that people are receiving. And it's not necessarily the case that people living in urban areas with pipe sewer connections are actually getting a better service than people living in rural areas. In fact, our data suggests some very high risks for urban populations despite having an apparently high level of service. So it's quite a complex picture, and we will continue to track progress in both settings and to show the different mix of technologies that people are using, and to be able to try and make some comparisons. But I think it's inevitable that we will have to start to look at other issues in urban areas, and in particular some of the links with the other SDG targets, which are particularly challenging. So whether it's safe treatment of wastewater and ambient water quality and water resources, many of those interlinked challenges are also more acute in urban areas. So I think the work that we do beyond WASH will increase as well with the SDGs, because they are more complex and they are more integrated, at least in terms of the way in which they've been conceived. So figuring out how we can put our data together with the data that's produced in other sectors, whether it's health or education or environment, even child mortality, I see, was raised as one of the questions. So that is something that we're being asked to do, is to get out of our silos and to work with others to put the data together. If we get it right, of course, it means that the data collection and the monitoring becomes more integrated and also more efficient. But there's a lot of work to do to break down those silos and to align with data collection processes in other sectors.
And just to follow up on the rural areas issue, in some middle income and even high income countries, there's quite a lot of interest in the unserved populations who tend to be in rural areas. And even in low income countries, I think the organizations or the institutions responsible for service delivery recognize their limitations in rural areas and usually are very keen to expand their coverage. I mean, if we think about regulators, like the regulator in Zambia has a very active program on how to extend regulatory coverage into rural areas, how to cover sanitation as well as covering drinking water. So I think just the fact that there's a current data gap isn't necessarily a negative, and it points to a solution that countries want to work towards. And I think the development community, the donors, need to be responsive to those demands. And I'm not so much worried about cherry picking and finding the households that are nearly safely managed and investing the minimum amount to tip over that line. I think countries are much more likely to set their own priorities to reach the unserved populations.
Yeah, and I agree with you. I think in some ways it's equally important that we start looking at this out of our silos and more as a whole system rather than just focusing on the WASH side. So the next question, yes, you did answer it in the chat box, but I want to raise it because it's something I spend a lot of time on. But looking at how we monitor the actual use of toilets, especially considering menstruation and menstrual hygiene management, and yeah, the fact that especially in Asia you get women who aren't allowed to use the toilet when they're menstruating, or you have the family dynamics, and yeah, that you're going to be including this in future surveys is quite exciting. And yeah, is that still are you still testing the questions on that?
Yeah, very much. So there's been a huge surge in interest in menstrual hygiene management, and there's a virtual conference that now happens every year, and a lot of agencies working on it, which is great. And so when we sat down to try and make recommendations for updating the questions that are used in household surveys, under hygiene we were looking at both hand washing and also menstrual hygiene management. In a household survey context, this is something that would obviously only be asked of women, so it would be normally through the women's questionnaire, which is separate to the household questionnaire. And those are structured in a particular way, and sometimes these questions would fall under a broader group of questions on reproductive health, or they may fall under questions on unmet need and family planning. So they go in different places in the survey, but there is an obvious place to put the questions, and increasingly we're seeing survey programs taking them up and testing them. And as they do, and as the data starts to come in, we can start to analyze it. So although it's not an SDG indicator per se, or it's not part of the definition of the SDG indicator, it's something that we could envisage reporting on, having a box in our report, or a series of tables in our report, showing the data that does become available. We're also looking at MHM in institutional settings. So some of the more difficult questions around MHM that are difficult to observe in a household setting, for example, can be observed in an institutional setting, a public setting. So we would want to look at both, and by putting that information together, you can then get a better picture of the general situation for women and girls. So it's definitely a live area of discussion. We have a small number of core questions that we're recommending, and a larger set of what we call expanded questions, which if you've got resources and this is a major focus of your programming, then we can recommend some additional ones that can be tried out.
I don't necessarily expect a response to this, but will it also extend in time to incontinence and those kind of issues, or that might be something that's a bit further down the line? I don't know. We're still just getting there with MHM. I wonder if incontinence is, another few years of work away for looking into that in more depth. I'm still only on the second page of questions, and there's quite a few to come.
So while you're doing that, Esther, I was going to ask both Rick and Tom a little question, because they recently published in the IWA a rather sensational statistic, which is not actually in the JMP report per se, but if you do calculations, you can derive it. And that is the 4.5 billion people that lack safe sanitation systems. And that is if you like, the news from the 2017 report compared to previous reports where everyone spoke of 2.5 billion lacking basic sanitation. What practical implications does that provide in terms of, doesn't that put a cold, wet blanket on the entire sector and say, this is impossible? 2030, just on the old coverage of 2.5 billion, that was maybe doable, but now we're talking about safe sanitation for more than half the world. What's happening with? Did you get responses from your article?
I don't think it's so much a wet blanket as raising the bar and recognizing the limitations of the previous numbers. Certainly in water, we were heavily criticized for relying on improved water without taking explicit consideration of drinking water quality. So of course, when you add other important service level elements, the coverage comes down, but that's because you're speaking of coverage with a higher level of service. So if you set your sights higher, it's an inevitable consequence, I think. But I think you still do have those numbers about basic services and even eliminating open defecation. So I think the continuity with the MDGs is there. So in one sense, the numbers aren't very changed if you look at apples to apples. It's when you add this new level that you have a different number.
I think it's important to add that the SDGs have been set in a very different way. They were set by politicians rather than by technocrats. I think with the MDGs, there was an effort to set targets that were based on recent historical trajectories and therefore should be achievable by 2015. Whereas the whole approach to the SDGs is much more ambitious. These are aspirational targets, and so the focus is on monitoring not necessarily the achievement of the targets, but more progress that is being made towards them. And there is much more flexibility for countries to set their own targets according to different stages of development and local context. And so the entire basis of the framework is quite different, and so we have to adapt accordingly. And we, of course, are trying to present a ladder that is going to be relevant to all countries and to give everybody something to do. But it's more in line with the sort of human rights perspective, which is progressive realization, and all countries can still make progress, and we can use a common ladder in order to be able to track relative rates of progress. No matter where you started on the ladder, the question is, are you making progress between 2015 and 2030?
So we've got looking at the threshold. So from Stuart at WaterAid, how did you decide on the threshold for estimates? So 30% safety managed versus 50% for basic. How did you come up with those numbers?
Well, I think the 50% rule we've been using traditionally, and in fact we have much higher data coverage for most of the basic indicators at the country level. So we've been, that's an existing rule that we had, and we do apply that even for safety managed at the country level. It's only when we're trying to say something about regions or globals that we need to have some approach to fill data gaps. And there are other indicators that face similar problems and have applied a 30% rule. So we felt that there was that precedent established that we could follow. But when we aggregate up the basic levels, including hand washing, we do apply a 50% rule, considering that it's a basic service, and we do have higher data coverage for those.
There's one from Naveen on ODS, and are there any thoughts going beyond a snapshot assessment to determine lifelong status and adding in a criteria which is more time-based for ODS? So seasonal changes in rural communities, for example, and that kind of statistical approach.
Well, I think all of the data sources, all of the household surveys that we draw on are snapshots. But by looking at them over time, you get a sense of the continuity at a population level in rural communities, in urban communities, what the trends are. But the surveys aren't designed to track progress in individual households, and in fact that's not the aim of global monitoring. So for population level statistics, I think we'll continue the practice of seeing how open defecation trends over time and looking what the rates of progress are. And that in fact does get you at sustainability at a population level, but not at the individual level.
Okay, yes. How have you dealt with refugee camps and displaced persons in doing this survey? Yeah, especially the longer-term refugee camps, so those that have been operating for over 10 years.
Oh,
right.
Good question. It's quite a big challenge, and it's a challenge that's specific to certain countries. In certain parts of the world, actually, where it's a very particular challenge. What we do is, in a survey, sometimes refugee camps are included as a separate stratifier, so we're able to separate out those populations. And what we would normally do through our country consultation is try and determine whether they are primarily rural or urban, and then we would include those within that population. So in some cases they are rural, and in most cases actually they tend to be urban, but it depends on the country. IDPs is completely different. So IDPs, if they are living in camps, then we might be able to get some information on them, but very often they are integrated within the host population. And so I was recently in Amman in Jordan, and we were discussing a lot about this whole question of how can we make an assessment of the situation of refugees from Syria versus the rest of the population. And we have a reasonably good idea of the situation of those that are living in the camps, but we have almost no idea about the situation of those who have been integrated into the host population. And so that's something that they're very interested to look at in Jordan, for obvious reasons. And in order to do that, you would need to adapt the surveys, the household surveys, in order to be able to ask additional questions about the different members of the family and where they came from, But it's obviously very sensitive and very difficult, and in many cases there will be reasons for not answering those questions correctly, or actually, well, reasons for recording the fact that you are hosting refugees, and also reasons for claiming that you are when you aren't. It depends where you are. So it's a very difficult area, and I think there's a lot more work going on to understand the migratory status of populations and to report on migrants and refugees as a disaggregated population group within SDG monitoring. So it goes much beyond just WASH, but it is something that we're working on a little bit in some countries, and working with colleagues who are looking at this from a nutrition perspective, or from a health perspective, where they're seeking to provide additional services to those populations.
Sure. So we're coming into the last 5 minutes or so. So I'm going to ask just kind of more of a summary question. But we had the track, kind of the predicted targets for 2015, which was the Millennium Development Goals, and we have our targets for 2030. So what's the prognosis? Are the countries that need the help getting the help, and how is the data that you're collecting helping to inform the direction that we take sanitation and hygiene heading towards 2030?
Quite a big question.
Yeah.
No, I know. I'm keeping it light.
Well, one thing to point out is that we monitor the outcomes, the facilities that people are using, and we stratify and look at inequalities and rates of change. But our report is not attempting to identify the reasons, the constraints, either for success or lack of success. We do work very closely, though, with other initiatives, including the GLASS initiative, which is much more on the inputs, the policies, the enabling environment. So, and are also involved in tracking Target 6A around international cooperation and development. But I think what we would like is that the more granular data that we're producing now, and things like the rates of change, make it easier to identify countries where progress is either good or bad or needs to be accelerated, and enable more focused targeting of those. We're also, we didn't have time to touch on this, but we're looking at additional ways to disaggregate and find out which populations within a country are making progress at lower rates or face more inequalities. So we've been doing that with urban and rural populations and poor and non-poor populations. We're starting to do that now for subnational populations as well, and that'll just be another way for national planners to, highlight the areas that require more attention and to direct resources toward them. But in terms, but we're not going to be the ones who are tracking, how much investment is going on, what the policies are, how effectively those are being applied.
Yeah, I think that's right. All I'd say is that our job really at the JMP is to kind of hold up a mirror and try and encourage the stakeholders in the sector to look at what they see and see whether they think it's accurate, and then secondly to do something about it. I think one of the big shifts that's going on is obviously UNICEF and WHO are very actively involved in supporting efforts to improve water sanitation and hygiene around the world, but there is no sense in which these problems can all be solved by international agencies, and in particular by bilateral and multilateral donors. I think in the SDG era, the vast majority of resources which will be invested in trying to tackle these challenges are coming from domestic sources and also from households themselves. And so again, the conversation is shifting from the MDG period, which was a lot about the transfer of resources from high-income countries to low-income countries, into a very different conversation about how we mobilize finance more generally, and build capacity and learn from each other. So it makes for a much more interesting conversation, and the JMP data is just really, it's just a starting point to trigger an interesting discussion, but we don't have all of the answers.
Great. I think I'm going to leave it there. I will summarize these questions and, as I've said, put them in the discussion thread for people to pick up with, and also make sure that the two of you get a copy so that you can send us any more useful links or just some inputs, which would be great. Hopefully in another year or so we can actually redo this, and you'll be heading towards the next reporting phase and we can see what the progress is, which will be amazing if you're willing to come back and do this again. Otherwise, thank you to everyone who's attended. We had over 70 participants at one point, and we had some good questions and discussions going on. The discussion will continue in the forum, so please do feel free to head over there and post your questions and your points. And otherwise, for those of you who are going to bed, good night, good afternoon, and good morning to wherever you might be in the world. And thank you very much, Rick and Tom, for your contribution. It's been really interesting. Thank you.
Pleasure.
Yeah, thanks for organizing this.
Thanks very much.
Right. Thanks, everyone.
Bye-bye.